right now everyone's training, everyone's kind of honing in on diet. And I think recovery is the one spot where the majority of athletes can really set themselves apart from their competition, right? Everyone's training hard. We talk about elite level. Everyone's got starting to dial in the diet. What do they do nutritionally? Are we recovering as hard as we train?
All right, first Optimal podcast. Here we go. It's Mr. Dr. Michael MacPherson. Been on a couple times, but we'll do some formal intros in a minute. But for everybody out there, this is not a commercial for the BFR cuffs, but we are going to talk about it. If you want to get them, we have some ways you can do that. But I think more importantly and selfishly for me, I want to learn about the science. So that's why I figured I'd bring Dr. Mike on here. So we got these Saga BFR cuffs, pretty awesome. These are the arm ones I have, and they come in this neat little bag. And then we have the leg one. So show some videos today, but I'm excited to learn them. I mean, not by any fault of Saga, because they have a really good app and good educational resources. And obviously I can always contact you and you'll tell me, but I've been lazy. So I have no clue what the hell I'm doing when I'm using them, but I have been getting some results from it. So
nice.
Pretty easy to use. I mean, I've been using it on my arms, and primarily I got to do the leg ones a little more, but I did actually have some friends that borrowed it, and they did read how to use it, and they got a lot of good results just with a couple days. So I wonder, for everybody who's out there listening, can you just talk about your background, your role at Saga, and why blood flow restriction? Just kind of give us a overview, I guess, of things.
Yeah. We'll go. Went up to Michigan Tech, played football there for my undergrad. Thought I wanted to be an engineer, ended up in exercise science. From there, I went on to as a strength conditioning coach at Michigan Tech, strength conditioning coach at University of Toledo. Ended up getting a high school job. Was the head strength coach, football coach, track coach for a time at Etzel Ford High School, and also taught some classes at some college classes I've taught. And then I ended up at Marine City. So I've been an educator, educated every science, college and high school, biology, biochemistry, physics, advanced physics, anatomy and phys, chemistry. Ended up earning my doctorate along the way. And at that time, I thought I'd make a change, wanted a new challenge, wanted to explore something different, was reading a lot of books, ended up in the operating room. And I was in sports medicine. I was a surgical consultant. And so what I was doing is Monday through Friday, I was in ACL reconstructions, rotator cuff repairs, lateral ankle complex reconstructions, you name it, any joint in the body, head to toe. If it was sports medicine, I was in those cases. Was doing that, really incredible, learning, understanding, seeing those things happen in real time and offering real solutions when a problem arose, and getting in contact with some different blood flow restriction companies. And they kind of reached out to me, hey, based on your education, your background as a strength conditioning coach, we really think there's a unique opportunity for you. So I started doing a little reading, dug into the literature, and couldn't believe it that I never heard of BFR. Really blew my mind with the results, the literature base. I mean, this stuff is from 1960s Japan is where it really originated. There's a Dr. Sato. Story goes, he shortened his recovery, halved his rehab time with an ankle and a knee injury using blood flow restriction. It kind of launches off there in the early 70s, first used in the Olympics in the 1988 Seoul Olympics, and then has grown since, and now has really become still not very prevalent in the US, but has come more of a global phenomenon in terms of elite athletes using it. Your soccer, your football clubs, I was just on the phone today with one of our alpine skier, one of our trainers there, and getting ready to do some stuff with the Saga cuffs, some studies with some of our US Olympians. So very highly utilized in the elite level. Once I started working with all these different professional sports teams, I had these conversations, you guys know the benefits. Why aren't we using more of it? And they'd flat out tell me, they say, hey, we don't have an education. It's at the top tier, but it's not getting down to those lower levels. Like, we need some education. And so that's when I went to work. I've read everything I could possibly get my hands on. I post daily on LinkedIn. I've written an ebook. I built out a course to educate people at clinicalbfr.com. And it is just everything you need to know: science, safety, mechanisms, and then different applications from rehab to general strength training to aerobic, to using it passively, right? A lot of our professional athletes don't even exercise with it. They just put it on, kick back, and relax. There's just a
Is it
tremendous amount of opportunity.
is this your website? Or is this the
Clinical
uh,
BFR.
yeah.
Yep, that's me.
Oh, nice. Yeah, so I'll share this really quick. I didn't even know this was here.
Yeah, yeah, I gotta do a better job.
No. I think you might have mentioned it actually. So for those out there, so you got some.
Yeah, like a little walkthrough. So there's over 200 studies in literature library. I post weekly updates, um, with different basically protocols, joint by joint, ankle, knee, hip, what's bothering you. We got protocols on there that can help you, kind of reduce that pain, increase that strength, whatever it is, maybe whatever goal you're working towards. But that is really the basis. Just really saw a need and thought, I can help some people here. You know, it's a lot in the elite sport, but at the end of the day, in my mind, the biggest thing: grandma, grandpa, mom, dad, aunts, and uncles, anyone who's been injured, this can help them tremendously because we're able to increase strength, muscle mass, mitigate fall risk using low loads or absolutely no load at all.
Yeah, so I wanted to get into a little bit. So for the general user, okay, so I'm gonna talk for a minute and then I want to follow end with a question. But so if I take my cuff, right, I have it, and I'm gonna say I'm gonna use upper limbs, so I'm gonna do my arms, right? So first question is, can you just do one arm, or should you always do both? Like, how does that work?
So you can do both or you can do one. It's really your choice, your preference. What I would recommend is, if you are suffering, if you have an arm that's behind, right? You experience an injury or surgery, and that arm's just lacking mobility. One arm's lacking mobility, one arm's lacking strength, anything along those lines. We want to do BFR on that limb. It would benefit. But at the end of the day, the benefits of BFR are systemic. So it becomes like a total body benefit. So utilizing two cuffs increases the benefit. So I usually strongly
I
recommend,
do too.
yeah, two cuffs. ACL reconstruction, I would say one cuff on that reconstructed leg until symmetry between the two limbs is up there. And then once we're balanced, we're going double legged.
Double leg. Okay, so yeah, I mean, and for those out there, like I have the Saga app. So if I hit start, mine was because my thing was, so I had a used previous long arms 141 mmHg. Is there a certain target of whatever that means? Like
Yeah.
I'm assuming that's a pressure it's reading.
Yeah. So you want to put the cuff, right? So you're either doing one arm or two arms, or you're doing one leg or two legs, never a top and bottom at the same time. And we always want to put that cuff in the most proximal portion of our limb. So as high up underneath the deltoid,
Okay.
as high as possible on the arms, or just underneath the glute, as high in the thigh as possible. Where you want to apply that pressure with that cuff, so it's tight enough that it doesn't fall off with you standing there, but it's loose enough you can slide a finger
Okay.
when it's on, right? So it's not like a tight right now. Now, what happens when what you're saying, that mmHg, those are millimeters of mercury. So what happens is very similar to a blood pressure cuff. Like when I was a kid, right? I'm at CVS, Rite Aid, Kroger. I'm putting my arm in that machine, feeling
Right.
it get tight. Same concept. There's a sensor in that pump. That cuff's going to inflate. And just like you getting your blood pressure taken at the doctor, when that pulse is no longer detectable, that's what that millimeter of mercury measurement is. And they call that your LOP, your limb occlusion pressure. In some research, you might see AOP, arterial occlusion pressure. But what that really means is that's the lowest amount of pressure you need to stop that pulse. And that becomes 100% of your pressure. And then we're always scaling back at that point.
Yeah. So if I ran it, I'm just gonna run calibrate. So right now it's tightening, and you can kind of hear it. And then I think well, I'll tell you in a second. It only takes a second to tighten up. So yeah, for people out there right now, like I said, it takes 15, 20 seconds, whatever, just slowly kind of tightening like a blood pressure cuff would. I already learned one thing because I think I did read that, but I did put it lower on my arm. I wasn't thinking when I did it before, so that's good.
Very
Probably could even try to squeeze a little higher, maybe, but But I did notice like inflammation of my elbows went down,
Yeah.
even though I didn't really have a set protocol I was doing. I just put it on and did some movements. But um, okay, yeah. So now that was just a calibration actually. So from this area, yeah, use that calibration because this is a new one. Okay, yeah. So now I'm going to begin my workout. So it starts off at 50%, 50% of the pressure for people out there, and then I'm calibrating it, or I just calibrated it with because it's higher in my arm now. But as far as percent goes, like how do you determine now? I'm at 50, the clock's going. How do I determine like what pressure I should go to? Like, is there? I know there's probably a lot of different ways to do it, but just generally, if I'm first time user, like little inflammation in my arms, like what would you recommend?
So a lot has to do with tolerance, how you feel with it. In the literature, a lot of the peer-reviewed evidence, you're going to see between 40% LOP and 80%. That range gets a little tighter for the upper body. Usually, just generally, like I myself, I'll go up to 80% in the upper body, but most people are going to hang between 30 and 60, just for tolerance. Now, you do become the more you do BFR, the more tolerable it will become. Your body really adapts to the pressure well, and there are some benefits in terms of like pain relief, like the mitigation effects of pain, excuse me, improve with higher pressures. However, you're still going to get great effects using low pressures. Like my elderly patients, I usually start them at 30% LOP, arms or legs, and go from there.
So I'm going at about a minute and a half right now. Like, how long should I do this as like a first time user?
Yeah.
Not
Right now, you're doing what's called passive BFR. So, right, even without a set protocol, just the act of occluding and changing the way blood flows into the limb spikes all sorts of anabolic hormones in the human body because oxygen's super important to us. Like we need it. So your body has, like a O2 sensor system, your
right.
hypoxia inducible factor. So it's regulating those levels, and those levels dip, alarm bells go off, and anabolic hormones go up. So that's why, right, without set protocols, you're still going to benefit. Depending on how we're using it, if we're using it passively like you are, 5 minutes on, 5 minutes off, 3 cycles. Simple as that. Just sitting there watching TV. You're going to
Now,
get it. Yep.
sorry, I was gonna say what if because I was doing this the other day, like just curls, tricep extensions. I was doing some shoulder movements. Would that be still considered passive because I don't have a resistance? Um,
It's a great question. Kind of, there are yes and no, right? So some people might say it's more active, like when they're doing quad sets and isometrics.
yeah.
However, is it going to hurt if you're doing it passively, deflate, inflate at 5 minutes on, 5 minutes off with those movements? Absolutely not. If anything, here's the biggest thing with BFR in my mind. It's like a sliding scale, right? So if I use higher pressures, I don't have to move as often because
Uh,
at the end of the day, you're trying to build up what's called hypoxia, which is a reduction in oxygen, mechanical stress, and metabolic stress. So if my pressure is high, my pressure is going to create a lot of those stimuluses for me. So I can keep movement low. When I bring pressure down and I want to get the same effect, I just got to increase movement. And now that movement with a lower pressure is going to produce mechanical stress, metabolic stress, and hypoxia.
okay. And then if I was doing passive, that answers my question. 3 sets of five, 5 on, 5 off. If I was using even a 10-pound weight, 15 pound, whatever, like because I know it's like a fraction of your normal weight, what would that cadence be like?
Yeah. So the continuous occlusion for the upper body, we want to limit it at 15 minutes. So once you hit the 15-minute mark, we're going to deflate 1 to 3 to 5 minutes, however long you need, and then we reinflate, finish the workout. For the
Oh,
lower
so I could do a full half-hour workout,
Oh, you could get after it now.
but
Now,
only 15 minutes at a time though.
yeah, you might not need to because there is right. We eventually hit a fatigue ceiling, right? Like now you're just doing your reps until failure. You're just creating muscle damage. You've already boosted the hormones, so there's always that to think about. Lower body's 20 minutes typically, and we take a little
I
break.
went to the gym, wear it warming up, do my warm up for 20 minutes, let's say, on my lower body, break for 3 to 5 minutes, and then I'm going to go do leg press. I could still turn the cuffs back on and do like leg press or curl or extension or some kind of whatever fill in the blank movement.
You got it. You got it. And you could do upright. You could have the lower body cuffs on and do an upper body workout. And you're going to get a great benefit. A lot of our early ACL patients will have them do upper body to just get, just do some curls and things along those lines to get those systemic effects with BFR. But going to the weight room, going to the gym, real simple kind of guidelines, 3 to 6 exercises, 3 sets of 15. We want to burn, we want to feel it. And when we feel that burn, that's that metabolic stress. That's basically when you get that pump. That's what we want.
Oh, I got it. So I just got to 5. So then I hit pause. Whoops, pause. And then I can hit the little blue button just to resume when I'm ready to do my next 5 minutes. Okay.
And what'll be coming soon to that app is there'll be a pressure cycles button. It's on the Android version now. It hasn't made to iOS yet. But what that'll do is it'll automate that whole thing. So you won't have to pause the workout. It'll inflate for 5 minutes, hold that pressure. And then when it hits 5 minutes, deflates automatically, rest for 5. It'll just come back and up and down.
Yeah, no, I like this too. I'm just going to share this with the audience out there because you have a here we go. You have this video I'm looking at for ankle.
Yeah.
You're doing talking about strong feet and ankles here.
Yeah. Big believer that the foot and ankle is right. It's our basement, our foundation, whatever it is. Maybe you're in a slab.
You have the cuffs here, just pointing this out for everybody who can't see this. Sorry to cut you off, but it's upper leg there, so that makes sense.
And if you any ankle injury, any foot injury, flat feet, plantar fasciitis, Achilles tendonitis, maybe you've had a lateral ankle complex reconstruction, BFR is an absolute game changer for helping out those feet. And it's just a series of exercises. I did 3 sets of 15, and it just really just does a great job of not only increasing strength, but the mobility improvements, the increase in dorsiflexion, plantar flexion in the ankle. Truly incredible.
No, that makes sense because I have, I think I shared with you before, but I had that sprained ankle, I don't know, 7-8 years ago, and I could still tell sometimes it's a little tight in there, and all that. So, no, so that's helpful because I think too, like the low resistance, that makes a lot of sense to do that. I did want to shift on some of this, some of the research. Like you said, it's daily, so there's a lot in here, obviously. But the one I wanted to bring this one up. What were your findings here? Let's see here. So this, if you guys want to check it out, we'll have this in the show notes. But you can go to his Dr. Mike's LinkedIn. You can see it all. But exercise with blood flow restriction, an effective alternative for the non-pharmaceutical treatment for muscle wasting. So what was the findings of this one? Do you recall?
Yeah, so when it comes to dealing with like sarcopenia, even with type 2 diabetics, they're dealing with that muscle wasting, or just anyone in general who's deconditioned. One of the biggest, I guess, draws to blood flow restriction when people find out about it is that you can use no load to very, very low loads and induce a very, very similar, almost the same muscular increase in strength, mass, and endurance as heavy load resistance training. I mean, we're talking boosts in growth hormone, testosterone, insulin-like growth factor, VEGF, BDNF, right? Vascular endothelial growth factor, brain-derived neurotropic factor. So these cuffs create really, in my mind, a true biohack. I know it's cliche, but this is all you. Nothing's being added to the system. We're just applying this cuff. And in response, the body boosts all of these anabolic hormones. So incredibly effective. Why it's so attractive to our older population, our older adults, our elderly. They can't get under a heavy load. And at the end of the day, the way I look at it, dealing with grandparents and people who have fallen, and when you fall and you break a hip, that's terrible. When you fall and you break anything, that's terrible. When we trip and we go to catch ourselves, that's a type 2 muscle fiber contraction. That is a fast twitch muscle fiber that catches us from falling. Blood flow, in order to strengthen those muscles and really activate them, the vast majority of people, you have to lift heavy loads and you have to lift high intensity. If you're post-op, you can't do that. If you're an older adult, or maybe you're contraindicated for whatever reason from lifting heavy loads, you can't do it. BFR gives you an opportunity to not only add strength, but prevent falls, improve the balance with incredibly light loads by just applying the cuff.
Yeah, I would imagine a lot of that is like knocking out inflammation or like stiffness and injury. Like, cause I think you mentioned before, do a lot of athletes use this on the plane ride home, things like that? Can you speak to that a little bit too, or?
Yeah, absolutely. So the three mechanisms that really drive it are hypoxia, mechanical stress, and metabolic stress. And at the end of the day, these three mechanisms drive increases in muscle protein synthesis. So it's encouraging healing and recovery, testosterone, growth hormone, insulin like growth factor, nitric oxide, vascular endothelial growth factor, and brain drive neurotropic factor. And why those two are especially important: vascular endothelial growth factor enhances a process called angiogenesis, which is the growth of new blood vessels.
Yep.
So phenomenal for the circulatory, the cardiovascular system. Brain drive neurotropic factor is a neuroprotective protein. So it enhances, and studies support this, it protects your brain, but learning, memory, cognition, it boosts those in studies. So brain drive neurotropic factor is one of the reasons that a lot of our professional athletes and our elite colleges, they're using BFR passively post concussion to help
Oh,
out with some of those issues. Yeah. So it's not, it used to just, the more it's studied, the more advances they're making with the applications. It was initially just, hey, let's get strong after surgery. Now it's like, oh, there's a lot of different ways to use this. A lot of our NBA teams, Major League Soccer, as well as all the football clubs over in Europe, they'll go on BFR walks, and with just not only reducing muscle soreness and kind of like restoring the legs, get rid of those dead legs, but it actually improves VO2 max, if you can believe that, simply walking.
hmm. Yeah, and it seems like there's a lot of those hormones that people are seeking peptides, supplements, pharmacology to spike a lot of these things. Well, this is like a tool that naturally will do it. Maybe they still need those other inventions, maybe not, or need is a relative term, right? Like maybe just for the way they want to feel,
Yeah.
but it's an added benefit at least. And then what I gather is, it's kind of like a taking a recovery supplements peptide thing to knock out the inflammation or the soreness. This is like just a more, you're helping nudge the body to do it naturally and flush a lot of that out is what I gather from it. Is that, am I kind of on the same
Yeah.
track there?
Absolutely. And one of the major benefits, right? So very similar increases in strength as heavy load resistance training. But with heavy load resistance training, you get all that muscle damage, and then your body responds by, we're gonna build a little bit more. So we broke down, and then we're gonna build up a little bit more. With BFR, you get all those benefits of the buildup or that recovery without that muscle damage. So your strength gains should be enhanced as well. They happen sooner. Fracture healing, right? There's actually multiple case studies that support half the time when it comes to healing a fracture with blood flow restriction.
Yeah, and there's certain movements that I know, given some time and patience, I can do effectively again, I'm sure, but like some just from sitting, etc., like the lower back gets stiff, and if I didn't loosen up enough to squat or do something like that, loading the spine when I'm not as mobile as I'd like to be or warmed up as I'd like to be, this is a good workaround too, because my muscles can still get the same work without loading my spine, is what I'm, you know, picturing with it. And there's different ways to not only use these, but you can also modify the movement itself to get rid of some of that. Cause that's one thing I've noticed is like sometimes my legs got so strong at one point, a couple different points, but especially in the 40s where my back couldn't hold up as
Yeah,
much as my legs could. But I think it was more, just the mobility issue than strength. Cause it was like, well, I can lift this much with my back, but it was more the constant, like just it's taking on the load at the wrong angle.
yeah.
And so this is a good workaround while I'm working through that a little bit to try to get better at the movement.
Absolutely. You could essentially, let's say you're doing 315 for 3 sets of 5. You could get the same stimulus doing 185 for 3 sets of 5 with the cuffs on, because it's create that same pump that you're chasing. The
Right.
cuffs create that automatically. And if I can share my backstory with you, 2018, I actually blacked out from pain and fell down our basement stairs. And my wife ended up, so for about 3 years, I was teaching, coaching, And I'm in the training room with the kids,
Yeah.
like, what's wrong with coach? What's wrong with you? I'm like, man, my back and like my hips are always off, always doing, squeezing the ball, clunk, resetting the hips. Like, you got SI joint inflammation. I was like, all right, well, I still got to squat. So it take me a half hour to warm up to squat and do these things. Ended up 2018, my wife's pregnant with our son. I'm getting demoed a bathroom. I'm walking down our basement stairs. I wake up at the bottom. I'm just beat up, hole in the drywall. She calls the ambulance. I blacked out and fell down the stairs. And like, I'm talking to the surgeon, like, what happened? He's like, pain, just overloaded the system. They do an MRI, L4, L5, disc between L4, L5, disc between L5, S1, tremendous amount of herniation. Ended up using BFR, right? So changed the way I train, started going more unilateral exercise, more rotational. I was like, all right, I felt I really trained myself into that with what I was doing by being just bilateral focused all the time. Started doing more unilateral work and then ended up getting with BFR. And I put it on, I put the cuffs on and I rode our exercise bike. I did it and I'm not even talking fast, 15 minutes, just keeping the legs moving. I take those cuffs off. I get goosebumps telling you this because it was like this instant shot up of blood where the cuffs came off through my glutes into my low back, and my low back
Ooh.
just and just like a breath just released. And I was like, that's when I was a believer. I was like, okay, like I'm gonna be screaming this because there's so many people who could, right? 80% of Americans are experiencing low back pain at
Right.
any given time. There's so many people that could be benefited from this. They still got
Yeah. Yeah. No, for sure. I did want to get back to the studies in a minute, but before I do, I had another question was, what about those people who say, oh, yeah, I see those things out there, or I'll wrap a band around myself and just restrict the blood and, just kind of makeshift it versus using something with the precision of like these saga cuffs that you get behind. What would, is there risk with that? What's the pros and cons to that? Like someone listens to this and says, oh, I'll just go and
yeah.
wrap a band around my leg and just start squatting.
Well, that's how we needed those people initially. Those were the
Right.
pioneers. But I would say, you're going to get the same results you get when you just go to the gym and you lift aimlessly, right? Like, we want a progressive overload. Well, one, safety's first and foremost very important. And what is very important with the BFR cuffs is the wider the cuff, we can actually use lower amounts of pressure to get the same levels of blood flow restriction. When that cuff gets really narrow, like some of those 5 centimeter straps or those tubings you see people use,
Yeah, yeah.
you got to use incredible amounts of pressure to get the same level of restriction. And usually you're going to get lots of bruising. You're going to do some damage. You might even inhibit some of that muscle growth due to the tautness of that. What I really like about the cuffs, right? So we're using lower pressures, which is far more comfortable, which it can be uncomfortable at the higher pressures. And then, so I want to avoid making it even more uncomfortable for someone. But this gives you the ability to document and have like a progressive overload, right? Like, how do you know you're getting better if you don't take the data, right? If I just go to the
Right.
gym every day and I'm benching 135 for 3 sets of 10 for my whole life, what am I doing? And it's kind of the same thing. We want to see growth. So Saga allows us to find that limb occlusion pressure, 30 seconds, boom, I got that personalized pressure that's for me. So I know it's safe for me. And then I can, right, if I'm going to keep reps, sets, rest, and exercise the same, I just vary my occlusion pressure. If
Mm,
I don't feel like hitting that same pressure today, like last week, I was feeling great. So I chased that pressure. This week, I've been beat up. It was just one of those weeks for me. I'm going to lower that pressure and maybe I just change up my rest. I do an extra set or I just, fluctuate that way, manipulate one of those variables for that progressive overload.
mm. That makes sense. Yeah, because I think too the like to me the percent of pressure like people you were saying earlier people just don't know like how much they're putting on there. So like you said, they're pioneers and kind of just got it going, but now there's an actual science and the research to back it and some precision type instruments like this, which I definitely would be that meathead that's doing it too tight and probably like I think I'm doing it right. And I actually, that's what I started doing with this. And luckily the calibration saved me, I'm sure, when I first started using it. But no, that's good stuff. And then I did want to grab a few more articles here. So I did see this another one. So you had one on creatine and BFR and muscle thickness. Can you talk a little about this study and kind of what the findings were there?
Yeah, so they found that, both there's, BFR group, creatine group, and then BFR and creatine, it all resulted with increases in muscle size, but it was just that BFR plus creatine outperformed everyone else. And the thought process is what happens when you're occluded, when you have that cuff on and you're getting that pump, that restriction, preventing that blood from flowing into the limb. Basically, what's happening to the muscles is they're like a sponge. They're being wrung out, right? Because they're not getting all the juice that they need, right? They're not getting the glucose, all the neurotransmitters for the contraction. So they're being wrung out, they're being squeezed out. And then when that pressure comes off and that oxygen rich, that fuel rich blood, glucose rich blood rushes into the limb, the muscles are like sponges, just put into a big old sink of water, and they're just they suck everything up. So the thought process is we're getting more glucose into the muscle cells, we're getting more creatine into those cells, more ATP, the ability to perform more muscular contractions and offset fatigue. And that's actually further supported in some of the type 2 diabetes research with BFR, which they find that we're able to get sugar out of we're getting able to get glucose out of the blood sooner
Tram
with
it into the muscle. Yeah. No, that makes a lot of sense. And from a physiology standpoint, we know that with like carb cycling or carb sensitivity after intense training, if your blood sugar is really low, like your body's going to be more naturally ability to like uptake those carbohydrates, or insulin sensitivities. When is it most sensitive? Things of that nature. That's why they say like resistance training is one of the best, prescriptions for someone who's diabetic or having some blood sugar regulation issues. But this, so that mechanism, I guess, stands up if you look at it in other ways that we've been using for at least 30, 40 years. That's pretty, most people know about. Like a lot of what I've seen used to is like calorie rotations where they're adjusting carbohydrates, and then they have like a high day because they're super sensitive, everything's deflated really low, and then they're driving all that in there and it's grabbing all those nutrients. Similar concept, but in more of a micro kind of approach, it sounds like.
Yeah, absolutely. Absolutely.
No, good stuff. Let me fix my screen here. So what are what are some other applications you see out there? Or to say it differently, phrase it differently, maybe the question would be like, what would you say for people, um what could they do with it? Like, what are some other things that work? I just finished my third set of 5. So
Nice.
what would, now I do need to do my legs. I strained my groin a little bit. It's not terrible, but it's definitely something there.
Oh, get some
Training.
shells, some butterflies with the BFR, change the game for you.
I'll be hooking it up after this. I just thought it might be weird if I'm
Yeah.
in front of the camera the whole time. But yeah, what are some other things like? So obviously creatine makes sense if they're using it with that. The uptake's going to be higher, is what I'm gathering from some of that. Is there any other nutrition supplements, things of that nature that like help with it, that's really stuck out, or is it still to be determined?
Early on, a lot of protein, right? So with your post-workout nutrition as a way to kind of right, so you get all that protein and a little bit of carb in your system post-exercise, post-game, post-competition, and then you're cycling the BFR, whether it's passively or you go on like a 5-minute walk and deflate, right? We're getting that same, we've just wrung out the muscles, and now that we got that belly full of protein post-exercise, it's going to give it an opportunity to kind of suck those additional molecules out of that bloodstream, deliver them to the muscles that are needing them.
Got it. No, I just found another one that interests me, so I had a little squirrel moment while you're explaining that, but I appreciate you walking us through it. Because like this one has specifically for MMA athletes and cold therapy in conjunction with this. Is that something that you see a lot of people using?
Not as much, but it's starting to pick up, right? Combining these other recovery modalities, just kind of get, how do we enhance the benefits, right? I think in my mind, right now, everyone's training, everyone's kind of honing in on diet. And I think recovery is the one spot where the majority of athletes can really set themselves apart from their competition, right? Everyone's training hard. We talk about elite level. Everyone's starting to dial in the diet. What do they do nutritionally? Are we recovering as hard as we train? So incredibly beneficial when you're able to stack some of these modalities. And what, you go back and forth with the cold tub. When do you use it? If you use it too soon after the weight room, is it going to blunt the adaptations of hypertrophy, right? Because we got the inflammation versus the anti-inflammation, that whole segue back and forth. BFR, right, is going to enhance if you're cooling everything down with the cold tub. BFR actually boosts heat shock proteins, those hypoxia inducible factors. So in my mind, I would stack those benefits, and I do. I'm a big believer in the cold, not just for the physical portion of it, but in actuality, I think the mental benefits far outweigh. When I hit, I was in Lake Huron over Christmas break. I walked down. My in-laws own a cottage in Canada where my father-in-law's family settled. They've been there since 1700s, if you can believe that, in the area. Late 1600s, early 1700s. Walked down to the beach. Had a spotter there, but went in the water, and it's just the mental aspects of the cold really just, in my mind, it's a game changer, right? All that anxiety you get, the discomfort ahead of time, then you get in and it's done, and it's like, it's things aren't so hard. And then when you deal
Right.
with real hard stuff, it's like, yeah, we can handle this.
No, that makes a lot of sense. Um, is there any um so well, let me take a step back. So because this was talking about like you would do BFR and then go in the ice, or BFR for 2 minutes, 8 minutes off, and then ice for 2 cycles, I think is what you're writing here.
Yeah, I believe so, if I'm remembering that one correctly.
Okay. So it's basically like you would rotate between the two.
Yeah, between the
Okay.
two.
Got it. Got it. Got it. Got it. What about like people trying to lose weight? Is there, I mean, I know it's not, well, I'll just, I guess, ask the question and leave it where it is. Like, where would this fit into like a weight loss regimen? I mean,
Absolutely enhances metabolism. If you can, I was actually just a couple of weeks ago, I was in Orlando for the American Physical Therapy Association, their private practice. And I had a couple of PTs came out to me and they just flat out said, I like it. I use BFR because I like the pump and I like the fat burning. He's like, my belly fat just evaporated using this every day. And I've noticed similar results, right? It just seems because you're dealing with a little more that, again, acute stresses, it's positive for the body. Chronic is where it becomes detrimental. But those acute stressful moments that BFR produces spikes that metabolism. And we're starting to shuttle more fat. We're burning more fat. Instead of carbs being converted to fat, it's giving carbs a destination, getting in the muscle because we need that energy to perform this. And when you're doing it passively, right now, you're sitting, you're binge watching your favorite show, whatever it may be. You're sitting on the couch, you're laying in bed. Um,
you're
you can
burning
do
more.
BFR right now. Best of both worlds. Good.
No, it makes sense. I was, I think the other thing in my brain's kind of popping off here too is like this watching this clip. I think at the beginning
Yeah.
she's got a lot of just, I do dynamic warm-ups, but I that's one thing that I need to start doing is slapping these on during my dynamic warm-ups because just like a low intensity you can go through, do the movements, loosen things up. I've been doing them for quite a while and I can tell a difference when I do not do them, like for sure, in
Yeah.
my mobility. And it's a lot of stuff. I'm bouncing around and hip openers and all kinds of weird stuff in a traditional weight room, but more sports related. But it helps. I mean, I'm like, well, like I got high school kids playing at a really high level of football. They're doing this,
Yeah.
and
Oh,
I'm in my 40s and sitting at a desk, and I'm not going to do it. Like,
spot
um,
spot on. I also I own Great Lakes Sports Medicine Performance here in St. Clair, Michigan, and all of our sessions, anyone I work with, any of my people that are part of my team work with, it always starts with some form of dynamic warm up. We are absolutely vital, and so we do a lot of it with BFR. And you talk about enhancing a benefit exponentially, that dynamic warm up, just the engagement, the mobility that BFR increases. Like I'm talking within a session. So that older gentleman you were scrolling through, um, we'll do just BFR walking forward and backward. We'll go and we'll do a couple different things, right? So feet are our foundation. Want to build a strong foundation. We'll do forward, backward walks in the gym. We'll walk on our heels. and we'll notice immediate improvements in hip flexion, immediate improvements within that first 3 minutes.
Yeah, I like that you're going through doing some just like with the stability ball, leg curl, things like that that are more functional in nature, but I'm sure it feels a lot more like a loaded hamstring curl with those on, which a lot of times, as you know, like loaded just for those out there, like I don't want to speak to it. I'll let you. If I'm loading up the hamstring and I'm lifting my hips up and rocking and stuff, like what other muscles am I using and where I'm taking off the pressure off my hamstring?
Yeah, no doubt. And so I'm a big believer. I do a lot of high rep hamstring with everyone. The vast majority of people I work with, and in my mind, if we're running, and a lot of sports demand you to run a lot. So why am I just going to train my hamstrings for 3 sets of 5 heavy RDLs? Because that's not what I'm doing when I'm sprinting on the football field, chasing a defender, or sprinting on the basketball court, or shuffling side to side of volleyball. So we'll do a lot of high rep hamstring exercises. And then when you add BFR to it, you want to talk about feeling the underlying, right? Like it goes from superficial, and now we're getting deep. And someone who, I played college football at Michigan Tech. I was a fullback. And it was squat as much as you can squat every time you get into the weight room. So I tore, 2 hamstring strains on my right, hamstring strain on my left. And I still feel the effects of those. I'll be quite honest with you, right? Like if I'm not warm, you don't warm up, you tight, get after it, and you're a little tight, you might have something. It has been absolutely highly effective with blood flow restriction in dealing with some of those old injuries, like your ankle, like you alluded to previously.
Yeah, I think like little things like I started doing it at the beginning of or not yet this year, probably in the fall, and I'd like to do it even more so, but I kind of called it like the women's like glute workout protocol because I just knew realized like my glute and upper hamstrings and the lower back, that whole area,
Yeah.
I wasn't training it enough, and that's where a lot of explosiveness and movement comes from. So I started doing a lot more what I would describe as like a you know like what women would do for like glute stuff,
Yeah.
glute activation stuff. And I started laying it in, trying to get it in more. I'm only really getting in like maybe twice a week at best. But I do think that adding the BFR to that routine will, help a lot for sure. I
And
think it's
right out the gate, I would tell anyone, if you are looking to do more in less time, add BFR to your workout. If you have areas that you feel are problems or lack strength or maybe are more injury prone, you should definitely be training those with BFR. Those are very low hanging fruit. And then you see it more and more, like what you're kind of speaking about, but the pelvic floor. You see all these pelvic floor physical therapists and issues with that control of the hips and the pelvis. BFR just lower, but now understand, right? We're not occluding, we're at the top of the limb, but we're changing the way blood leaves those
mm,
legs and reports back to, let's call it, reports back to the hips and the pelvis. You change the way blood is flowing into those areas, you've altered it. The body has to respond.
what
And
about
then
like a glute bridge. Like if I was doing the high cuffs and then doing just like very isolated glute work, that would same benefit.
100% every Wednesday, you'll catch me doing them. I'll shoot a video for you. I'll tag you tomorrow.
All
But I
right.
do all our bridging work, and it takes a bridge where, right, like you could definitely cheat a front bridge or a plank, whatever you want to call it, a back bridge, and be like, okay, this isn't too bad. It's very difficult to do with BFR. You feel it. And then when you want to take it to that next level, you are like, whoa.
Interesting. And you feel a big rush, I would imagine, when you take it off, huh?
Yeah, yes.
Yeah.
Great
Yeah.
pump too. So when I'll do the front bridge too, I'll kind of like lever on my toes. So I'll push my body forward and get a little more. If I'm on my hands, I'll be a little more chin over hands, or on my really lean forward and get a little more wrist flexion. You feel it. The whole body you feel, especially in those glutes and into that core region. Anything, if I go like pecs below, I'm doing lower body BFR. Just my preference, what I really like to do. But if I'm going to hit anything, lats, rhomboids, traps, pecs, deltoids, or even like neck, because we still, train a lot of football players. I still do a lot of neck just because neck injuries, it feels good to keep it strong. I'll do upper body BFR, and not only the strengthening, but the pain relief, especially all of our football players out there, neck, shoulder pain. It is unbelievable and how it just instantaneously relieves those issues.
Yeah, no, for sure. Well, I know we're going to have you back on with some other strength coaches and different experts that we have just to have a roundtable discussion around other exercise related things, from a heavy science background with, back literature to support what we're going to talk about in that show. So we're really looking forward to that. So if you guys are checking us out, be sure to subscribe and turn on your notifications so you know when that episode's released, probably sometime in the next month. But yeah, Dr. Mike, where else can people find you? Like if you want to just maybe say one more time your socials and websites, and we'll wrap on that.
Yeah, absolutely. I'm on LinkedIn, MacPherson PhD. You can find me. I post daily BFR articles. You might even hashtag blood flow restriction. You might see my face. Instagram handle. So I got a couple of them, but there's clinical BFR. That's going to be BFR with myself and everyone I'm working with. GL Sports MP, which is Great Lakes Sports Medicine and Performance, and that's the gym. You'll see similar posts there. YouTube, Clinical BFR, and then clinicalbfr.com. You can check out the education, and we're getting ready to offer some advanced protocols and really starting to build that out based on everything we're learning.
Awesome. Well, as always, thanks so much for joining us, and looking forward to having you on again in the future. So
Awesome.
we'll
Thank you,
see you.
Joe.
Take care.